Good morning. My name is Dr. Melody Keith here at Lakeway Aquatic Physical Therapy in Lakeway, Texas. And we are doing our Snap-N-Rs. And so this is just kind of a little informational, quick thing to help you. We have a bunch of them on YouTube and on our Facebook page. We'd love it if you'd like us at either one of those places. We also have people that are here actually watching live, so we're pretty excited about that. But today, here, what we're going to do is talk about lower back pain. And, you know, again, when you think of lower back pain, all of you out there have friends and families and people that have in the past had lower back pain. And the pain is so severe sometimes that you can't move. You don't know what you've done, how you've done it, what to get out of it, things like that. So what we do here at Lakeway Aquatic Physical Therapy is we actually diagnose what is going on and help you with things that you're doing at home that might be causing your back pain, and then giving you exercises, mobility, flexibility, strength training, things that you can do to help lower back pain. And again, the evidence keeps telling us over and over and over again that before you get on medications and go and get shots and all of that stuff, you should come to physical therapy. Try physical therapy first. Exercise wins out every single time. Every evidence-based exercise program, exercise versus drugs, always exercise wins out better. Okay? Is it going to take your pain completely away? It may not, but it may help you enough and give you enough tools in your toolbox to help you. So what I'm going to direct today is about a lot of my patients have been saying, well, when I get back pain, what I do is I just lay on a flat surface. I either get on the floor or I lie on my back and just try to stretch out a little bit. And that seems to help my back for a little bit. So what I'm going to do is kind of tipsy-turny that whole thing because of the biomechanics of the pelvis and your posture. We all sit too much, except for me when I'm walking around all day, but we all sit too much. We all are doing things that keep us in that forward posture, especially if you're at home working all day. And I'm going to tell you to not get on your back, although you can get on your back and rest, that's fine, but I want you to get on your stomach. And if just lying flat on your stomach hurts too much, you can do just what Amy's doing here. We've got a couple of pillows underneath her hips, and she's actually lying flat. She's trying to activate her glutes and push the front of her pelvis into the pillows gently. Again, if it increases your back pain, don't push so hard. Go easy, right? If something happens and you go, wait a minute, I can't get on my stomach, I can't do that, then you'll have to keep trying to find things, maybe over a ball, maybe over, a bunch more pillows, or the back of your couch, where you're hanging on the back of your couch and you're just laying over the back of your couch and your couch pillows, okay? So prone stuff is wonderful. Now, after that, if you feel like, oh, I want to get back on my back and stretch, that's great. Get back on your back and stretch. The next exercise that I want to do is to stretch hip flexors. And we always talk about hip flexors because what they do is they malalign the pelvis. So when you have what we call an anterior rotation, that's when you walk with your knees slightly bent and your pelvis forward, and that shifts your whole body. And all of my back patients that walk in like this come in and say, my balance is off, my knees hurt, my back hurts. And that's when we go, okay, I've got to first of all get you prone on your stomach, stretch out a little bit, and then we're going to get you into a hip flexor stretch. And the one that we love here is just a nice simple hip flexor stretch where I'm going to come in, I'm going to lay down on my back, I'm going to get a pillow up underneath my shoulders and my head, and I'm just going to gently drop a leg off. If you feel like your lumbar spine is up, then you need need to bring your knee to chest. And sometimes even bring your chest up so that you can feel it here, right? Not just a quad stretch, but hip flexor all the way up. And this may take some time. You may have to do it, where you're dropping your leg off, put your foot someplace, maybe on an ottoman. You may have to try it. And we do a lot of that trial and error stuff here, where we have to, because there's a lot of ways to stretch this muscle, but we've got to try to find the ways that works best for each individual person. And that's how we can individualize your home exercise program for you. But just so that you know that if we get you here and that's not solving your back pain, guess what? We can put you in the pool, and that will also help unweight, so that then we can keep your back moving, keep the mobility, keep the movement into the spine, into the hips, into the pelvis, and then take the stress away from the lumbar spine. So there's always things that we can do in physical therapy to help lower back pain. Again, if you have any questions, please feel free to call us here at Lakeway Aquatic Physical Therapy. You can also find us online, and then you can also just email us anytime you want. We'd love to see you. If you have any questions, please feel free to call me or email me. You have all the stuff on our Facebook page. We appreciate it. Thanks. Have a great day.